Blunt, DeBar, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins. We have a quorum.
I was afraid of that. Well, next thing you know, we'll be passing legislation. I'd like to go to the second item on the agenda, Senate Bill 2679. This is, to my way of thinking, more a technical correction bill than anything else. A number of years ago, Mississippi established a reporting system which requires recipients to report more frequently than federal law. Because the state has established this reporting system, if we don't comply with it, it costs us money potentially, and we get lower ratings for failure to comply with our own law. The system requires beneficiaries to report changes of income. If they fail to report a change in income, even though that does not affect their eligibility, nevertheless, we're penalized for that. And what this bill does is put us in line with literally 49 other states who do not have legislation on the books that has the effect of penalizing ourselves for something that is of no consequence. That's what the bill does. Is there a motion? There's a motion title sufficient to pass. Is there further debate? Ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. The next item is Senate Bill 2695, the Mississippi Professional Massage Therapy Act. There's no change in the existing law. It has a repealer, as is frequently the case. I'm asked to introduce bills dealing with repealers. And so somewhere, probably the last page, first page? It extends until 2029. There's a motion title sufficient to pass. Debate, discussion. All in favor say aye. All opposed, no. Ayes appear to have it. The ayes have it. Senate Bill 2698 is another de facto repealer bill that I was asked to introduce, so I did. The language that changes is on lines 23 and 24, which extends this program until 2029. The motion title sufficient to pass. Discussion? Right? Are you ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2705, which we'll take up next, is the Genetic Counselor Practice Act. I will point out that we have Senate Bill 2075 on the agenda, in addition to Bill 2705, which creates confusion for some of us, but nevertheless, that happened. So at 2705, the bill is a proposal primarily from the University of Mississippi Medical Center, among other people, to license genetic counselors. A genetic counselor, as I understand it, is someone who deals with parents who have a child that's been born with certain inherited situations, and to sit and explain that to them, and to deal with those who have illnesses which may be determined by genetics and explain to them their options of being tested and the advantages and disadvantages of each. This is taking place now, but this would standardize the area and provide for licensing. That's my rather glib explanation of the bill. Is there a motion title sufficient to pass? Senator Parker has a question.
Thank you, Mr. Chairman. Just kind of thumbing through here real quick. Is this a new standalone board, or am I reading it as it's a subsection under the Department of Health? I'm just trying to look at it.
My
quickly.
understanding is that the license would be issued by the Department of Health.
So it's not a new occupational licensure board with, I didn't see the typical things where we have, like a representative from each congressional district, or how we typically set this up. This is just more of a,
I think the Board of Health would be in charge of issuing the license, just as a matter of course.
thank you.
Senator Turner Ford.
Thank you, Mr. Chairman. I'm not familiar with, I guess, genetic counselors. Would these individuals be able to stand alone if this license is created, operate a practice,
I think they can do that now.
but there's no license currently?
That's correct. That's my understanding. I mean, it's there's no prohibition about.
And it's, the language says that it requires a master's and a bachelor's, or a bachelor's and a master's degree. So I guess the master's is the highest level of education that is required for this license.
I assume so.
Counselor, you don't have to be a doctor.
I think we have some people here from the University Medical Center who might be able to give more specific answers to the questions if you would like.
I would, not a lot of time, but just, more, somewhat of a description of this.
If you don't mind, if you're prepared to answer questions about the bill, you can either find one of these microphones or go there, whichever is easier. Sure.
What was your question again? I'm sorry. Right. Yeah, so as I understand it, the highest level degree for a genetic counselor is a master's level degree. There aren't any programs in Mississippi where you can, like any programs where you can become a genetic counselor. They do practice underneath a physician, typically a geneticist. We have around 5 or 6 genetic counselors who practice at the medical center currently. Yep.
Senator Hickman.
Just a quick question. As I read this, these individuals would already have to have some type of national licensure before they apply. This is basically just giving the state some oversight.
Right.
Go ahead.
Yes, they take a board exam, a national board exam. There's not a licensure pathway in Mississippi currently, and we're requesting that through the health department. They feel that it would be a good way to regulate this practice and eventually recruit and retain more genetic counselors into the state. They do a lot of work in cancer genetic counseling, neurological genetic counseling. They work a lot with children at the Children's Hospital for pediatric genetic disorders, helping educate families on what those disorders are. That's why they've reached out to us about this.
So all the people that are practicing now, I think you say you have 5 at UMMC, they would already have national life. This just give the state some oversight and foot in the game and basically says, hey, we want this, we're open for this, but also we have a system set up where we can also regulate this and make sure it's being done correctly for Mississippians.
That's correct.
Thank you.
Senator Hill.
I guess my question would be if they're nationally licensed and they're already practicing and they're already employed, if the university or whomever's employing them were not satisfied with how they were doing their job, they could simply relieve them of their employment. I'm just concerned as to why we're creating a new licensing agency if there's already a credentialing national agency and they're already practicing in the state of Mississippi. So I guess putting another layer of licensing would be my concern. So if somebody could speak to that, if
I
they're
think-
working now, what's the problem?
My understanding is there are implications for reimbursement by insurance.
So Medicare, Medicaid reimbursement, or I didn't hear you,
All types of insurance.
insurance? So unless
There
they're
are
licensed.
situations under which if the state licenses someone, you can get insurance coverage and otherwise not.
Okay, so this is
That
basically
That may
just,
be behind a number of licensing
okay.
proposals.
I did not know that. So that is basically so that the insurance will cover the counseling for whomever's working underneath the doctor. If they see that person rather than seeing the doctor right now, insurance won't cover it because they're not licensed in Mississippi. Is that correct?
May I answer the question?
Please.
Yes, so right now they can't bill insurance because they're not licensed through the state, as I understand it. They're salaried employees of the medical center. But in other states that surround Mississippi that have licensure, they're able to bill insurance. So that is another positive reason, towards licensure.
Okay, I would say let's check with Commissioner Cheney's office also on that to make sure that we're not missing anything. But I understand better now. Thank you.
Thank you.
Senator Parker.
Thank you, Mr. Chairman. Just a follow-up question here on line 215, 16, 17. Kind of goes into the effect that, we're going to have this new genetic counselor licensing agency, but it says here, however, the person, and I think it's kind of describing other people. So if someone is doing this right now and is doing it in however fashion they are, that person then, to say that they're a genetic counselor, if this were passed, they could not say that in any form or fashion unless they receive this license.
That's correct.
So I'm not familiar with this. Are there people who don't have master's degrees who are doing genetic counseling in the state who may be in a, smaller community or something like that, who then would not be able to provide that service?
I think the reason for the language is from a public safety, public harm standpoint, to make sure that someone is not out there advising someone on doing genetic counseling without the proper, board certification and proper education. That's the reason for the line.
And while I agree, I wonder if perhaps somebody is working for someone else who, say an oncologist, for example, in an area, and they don't have a master's degree, but they're performing the work of genetic counseling for the oncologist. Would that person then not be able to do genetic counseling or say they're doing genetic counseling, even if they're talking to the patient as an agent of the oncologist? And again, this is my first time to just start thinking about this, but I know just in being on this committee for a long time, when we set up or when we alter or change any licensure boards, or when we ask for any profession to change scope at all, it's a pretty labor intensive action of this committee.
Mhm.
And I just want to be sure whatever we're doing here, we're doing correctly.
Right?
Well, if I can try to answer,
Absolutely, that'd be great.
I think this is a situation. If I'm a physician, if I'm a nurse practitioner, in the ordinary, let's say a family practice, nurse practitioner, in the ordinary course of my business or of my profession, I talk to people about every healthcare issue imaginable, including genetic issues. And this simply says, if that's what you're doing, you're a physician, you're a nurse practitioner, you've already got authority to have these conversations, that's fine. You just can't open an office called Genetic Counselors or Us and start telling the public, come here for purposes of genetic counseling. I think I've got that.
Just the last question, is there a fee that they would pay for this?
Yes.
But it doesn't say how much.
And who and where would that fee go?
Line 173.
Right now, it's on payment, there would be a payment for the licensure, but that would be determined by the State Board of Health. That's how it's structured in the bill.
Senator Fillingane?
Thank you, Mr. Chairman, for a question. And Ms. Moak Sparks, you may very well be the most favorite person in this building. As far as I'm concerned, you do a great job, and thanks for being with us this afternoon. Just if you don't know the answer to this question, you probably weren't prepared for this interrogation. Just we'll ask somebody else, but I'm just curious. The geneticists that are working currently at UMMC, do you know, do they do any counseling regarding preborn genetics?
I would imagine they do. I know we have geneticists within the Children's Hospital. I can ask one of our geneticists and get you some answers as to what all they do. But I know that we do a lot of work from the genetic side in the Children's Hospital and within our cancer center.
And looking at the bill where, like on line 70, where they're discussing inheritance, I assume that part of the role would be to say, based on this type of disease, that you have the possibility of passing this along to a future generation would be, X, Y, Z, which I think is certainly appropriate, and I would want that. But my concern is whether or not they're saying this child that is now growing inside the mother's womb, it's got all these issues, all these problems. Maybe you want to terminate that pregnancy before we move forward to a birth. Do you know, is there any of that type of counseling going on?
I do not think there is. I mean, I'll be happy to check, but no, that has not been brought to my attention.
Great.
But I'll be happy to check if you would like me to.
I would love that. Thank you so much. Thank you, Mr. Chairman.
Other questions? Are you ready to vote? Oh, Senator Hill.
Just to follow up, to take the national licensing exam, does that require the same level of education that this state license requires? For them to get the national certification that you
Well,
said they have?
it's not a national license, it's a board exam.
A board exam.
Yeah.
So do they have to have the same credentials of education to take the board exam?
As I understand it, yes.
Okay. So if they pass the board exam and they're licensed, y'all just want a way to be able to take their license if they're acting not in good faith or something like that? A state license, I mean, you could always fire somebody if they're not doing their job, but my concern is just adding another layer of licensure and another fee that we don't know where it's even going to go. If it's going to go to the health department, how much it's going to be. That's my concern, is adding another layer for somebody to be able to work in the state.
Right. Well, there isn't licensure right now. They take a board exam. As I understand it, they are wanting licensure so that, one, it's a way of protecting the public. It's a, way of regulating this field throughout the state, which doesn't exist right now. It's a way to help recruit and retain these individuals to come to Mississippi and stay in Mississippi. And again, as I understand it, I believe this is correct about the insurance issue, that they would be able to bill insurance, because they can't do that right now. So those are the main reasons. As far as the fee, if there's a suggestion for a specific fee to put in the bill or take it out, we're not, that's fine with us. That's just what was presented to me as the language, so.
Well, I think Senator Hill, this may be a weird situation where uh, paying the fee, whatever it is, actually increases availability of services in Mississippi. I mean, if you think through it, if you've got an oncology center and there are individuals who are diagnosed with cancer or susceptibility to cancer, whatever. It's my understanding that there are some treatments for that are based on genetics. And so you would want people to sit down and talk through them. And in the long term, that's a good thing in that you want people to get good health care as an end to itself. And in the long run, it's probably better for the system and everybody else to get an early diagnosis rather than a late one and to have more knowledge of treatment options and on and on and on. If in fact the license allows reimbursement by insurance, one of these situations where it's probably long-term in the interest of the insurance companies to do that, then you want more genetic counselors, and the inability to get insurance reimbursement is having genetic counselors find surrounding states more attractive than Mississippi.
Trust me, I want the insurance to pay.
So
Thank you.
I really share your basic concern about, do we really need all these licenses and on and on and on. I'm somewhat in sympathy with your point of view there, but I think this, even considering that, this may be the best. Anyway, that's my perspective. Senator Parker.
So I guess just one last question. Do you have any?
Promise?
No, no promise. Do you have any like letter, or do you have anything from a genetic counselor or anyone in the state in support of this? Do you have any anything you can show us that, where people within this profession are in need of this, or is that something you could get for us?
I could get that for you. I'm not sure where other genetic counselors are practicing in the state. I know we employ several of them, like I mentioned earlier, and they're the ones who brought us this issue. So I'm happy if you would like a letter from them, I can get that drafted for you.
I would be more interested in letters from people who are practicing outside of the Jackson area.
Okay.
Because that's my concern, is that, I certainly don't want to, hinder someone practicing somewhere, and I just don't know right now. And
From what I understand,
but
it's a
I'm
very
sure-
small group of people in the state. In fact, we may be the only place that employs them. I'm not sure if there are others, but I can check.
Okay, great. Thank you.
Further discussion? We ready to vote? We have a motion, title sufficient, do pass. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. The next bill on the agenda is Senate Bill 2743, which I had thought was on yesterday's agenda, but you'll notice I made a mistake. Just pausing for the applause to die down. But this is the bill that I was explaining yesterday and that I'd previously discussed to Senator Hobson. There exist out at the State Board of Health funds that have been collected from birth certificates over the years. what happens with those funds is an appropriations issue, but this bill gives the authority to use those funds for public health programs pertaining to maternal, infant, and child health, as well as completion of vital records and statistics. All of this is subject to appropriation. It's a special fund. They've got to go get authority from Appropriations Committee to do it. But this would be the general law that would give appropriations that authority. So there is a motion, title sufficient, do pass. Is there debate or question? Senator Hobson.
Thank you, Mr. Chairman. You and I discussed deleting the terms such as those, so it
We
specifies that
certainly
it's,
did. Would you like to offer that?
I would
amendment?
offer that as an amendment,
You
please.
strike the words such as those on line 31, which I was going to offer in the nature of a technical amendment and forgot to. All in favor of the amendment, say aye. All opposed, no. The ayes appear to have it. The ayes have it. And Senator Hobson moves title sufficient do pass committee substitute. You ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2749 is a bill introduced by Senator Boyd, and she's come to the committee meeting. So if there are any questions, we can force Senator Boyd to answer those questions. But I can tell you in the most general of terms, the community health worker is an opportunity, I believe, for us to dramatically improve healthcare at dramatically low cost, or however you want to phrase that. It's a relatively low cost intervention that has a lot of upside. And basically, a community health worker is someone who follows up on people who have come in contact with the healthcare structure and need to follow up on taking medicine, who need to improve their diets, who need to exercise more. And for a variety of reasons, including just not being as involved with healthcare as some other people are, distance, poverty, all the usual factors that would create a problem. And so this literally encourages people to take, someone who goes by it encourages people to take drugs as scheduled, encourages people to keep appointments, encourages people to exercise, encourages people to watch their diet, all of those things. And of course, not every single person gets every single service. It's what the community health worker feels is most appropriate for the individual. So that is sort of a broad discussion of what the bill does. And it would direct the Division of Medicaid to get a waiver so that Medicaid could pay for these individuals, for those to pay for the community health service. The services provided by the community health worker, and they're seeing individuals who are enrolled in Medicaid. Senator Boyd, how much of that was accurate, and it left out a lot of stuff? Okay, so my explanation, such as it was generally accurate. But there's a motion, title sufficient to pass, but do members of the committee have questions, debate? Senator Parker.
Thank you, Mr. Chairman. There's one, I'm trying to get back to where, so you kind of gets back to what we were talking on last one. So in section 4, starting in line 115, we'll get down to, these are the actions of the department as you do this. So on line 126 and 127, it says Department of Health shall set the scope of practice for the licensed community healthcare worker. Yeah, again, in light of our previous discussion and how serious we have taken scope of practice in this committee and continue to have different groups who have scope of practice concerns and issues that would like to be heard. How broad could the Department of Health set that scope to be? I mean, and I don't think they would. Don't get me wrong. I just am posing the question because I don't know in our statute where we have given any department that ability to do that. And you can correct me if I'm wrong, or if I should or should not have that concern on it.
I was going to see if we could trick Senator Boyd into coming up here and answering that question, but Senator Boyd, do you want to?
Senator Parker, one of the reasons that we put this language in here, the way that it is placed in here is that, louder, sorry. One of the reasons we put the language in here just a little bit broad, knowing that we have the guardrails of the Department of Health, because this is an agency that is going to make sure that the guardrails are not too wide on this, that there's very narrow focus. But one of the reasons that we wanted to do this, and they will start out with very small guardrails. Dr. Edney, we've had extensive conversations about it. This body passed this piece of legislation last year and it died in the House. But one of the reasons we want to do this is the other states, they started out with community health worker program. Maybe they worked in maternal health. They've also, like Texas started the program, I think in 19. They now have them working with mental health issues. So the reason that we left a little bit of flexibility in there, looking at that scope of practice as the department sees and will very regulate what is going on in this arena. We know that we want to give them just a little bit of flexibility because as we see success in like maternal health, which is where they're going to be focused at first, as we see success in that, then we could also expand to possibly mental health issues. And they have served effectively in like the Texas. It's been a very low cost to do this. And so that's why it's kind of worded the way it is, just so the department, because we're not talking about, we know the department is going to closely regulate and look at this. They also have a board that they answer to as well. And so that's why the language is just a little bit broader than it typically would be, so that we can let them do some expansion as the program grows and is successful.
I'm sorry. I was just going to make a suggestion that is a matter of logistics. If you wanted to think further about how you might word a provision that would say, provided, however, you can't do these things, or word a provision that says shall be limited to the following things. I'll bet you that if the committee feels comfortable putting the bill on the calendar, that you could work with the Department of Health and the other interested people and come up with some language that might reassure you about the concern that you express.
Right. And, and I guess sometimes one discussion leads us into another one, but as I read that language now, I believe that language could say that the Department of Health could then have this community health worker be a genetic counselor. Because if they can set the scope, and we just debated that bill in lengthy fashion, but to be able to set the scope is a pretty, it's a pretty important issue, and I just, to Senator Bryan's point, I probably just missed it last time because the other bill didn't come up before, but if we could just get some clarification there, I think it would be better.
Personally, I think you've raised a reasonable point, and I'm confident that we could come up with some consensus language that would make you feel better about things and not hurt what the intent of the bill is at all. If you think, well, that's Senator Hobson.
Thank you, Mr. Chairman. I'll ask you, and Senator Boyd could answer this too, but do we need the preamble in there? I'm not even sure what the association
No,
of
we
state.
don't need the preamble.
I'm not a big fan of preambles anyway, but I don't see it doing much help to the bill, and that, but Senator Boyd may feel otherwise, but I personally not a big fan of preambles.
Senator Hobson, since it was such a new concept last year, this is kind of taken straight from last year's bill. That's why we put the preamble in there, just to kind of introduce what this was to people. But I certainly agree with what you're stating.
Would you be willing to accept a motion to amend to remove the preamble?
It's not up to
Thank you.
her,
Well,
it's up to the
Mr. Chairman,
committee.
Thank you, are correct. I apologize,
We
Mr.
can
Chairman.
vote
Would you
on
be
it.
willing to
We can
accept?
run over if we want.
Would you
to.
entertain a motion from Senator Hobson to remove?
Maybe you could ask her if she thought if she would think it was a bad idea to have.
Great idea.
Other questions? Senator Hill.
I guess my question would be along the same lines of Senator Parker's, because we don't have a level of education. We don't know how they're going to be trained or who's going to train them or what their actual requirements are going to be. But yet we're setting this new licensure. It seems like we're getting ahead of ourselves maybe, but it's just like there's a lot left out there on the table to create a new licensure and we don't know anything about it. That's just my concern. I don't have a problem doing this if we actually know what they're going to do, how they're going to be trained, what their level of education is, what they're going to be paid, that type of thing. Would you agree?
I think in the nature of the nature of the employment, it does not require a lot of book learning. It requires knowledge about things like taking your medicine and exercise and those things, which many of us take for granted that we know, but I mean,
We're still going to have some kind of training.
just speaking for myself, maybe I should be embarrassed to say this, but I didn't know that diet could prevent the onset of diabetes until after I got elected to the legislature. I never thought about that. So I don't know that there's a large level of book learning. What I think the job calls for more than anything else is communication skills and the ability to relate to the people you're talking about. So
Right. Well, we have too many high school graduates that can't communicate. So I'm just concerned about.
high school graduates, we've got members of this legislature.
Yeah, that might be true too. But I'm not opposed to this concept. I'm like Senator Parker. I'd like a little bit more information put in the bill if we can do that.
Senator Turner Ford.
Thank you, Mr. Chairman. I was trying to scan the bill and my question is, with this license, it seems like this individual could work for an insurance company, some other entity. Is this limited to the federally qualified health centers, or is this just a license where, as I mentioned, some physician, I'd say dental practice, mental health, could employ this type of person?
Senator Boyd, why don't you?
Yes, ma'am. One of the reasons they were bringing before licensure, just to be candid as to why we're even having licensure, because we could have the Department of Health set up this program, is the Department of Medicaid has requested that there be a licensure on this. And so that's one of the reasons, just for informational purposes, that we are bringing forth the licensure of this aspect, just to let y'all know. But these are individuals that could work for other people as well. Primarily what you see in the other states that they primarily do work in Medicaid and a lot of those populations, because these are they're lay people oftentimes in the community, back to what the chairman stated. They're lay people in the community that have developed a special niche in healthcare, that they are trained to do this, and they provide navigation a lot of times, helping people understand what doctor to go to and helping them with medication, as he said, like really navigating them in general health. I think some states even may call them navigators in several of the programs. So that's one of the reasons kind of for doing it and handling it that way.
So would these individuals could they be employees? Could they exist as independent contractors? would they have to, I guess like with nurses, they have to be in collaborative agreements? Could these individuals stand alone and offer this type of service?
Well, right now, what we're seeking to do is really, this particular program that we've got through the Department of Health right now, it would be through this program. I believe that as we're doing this, and I'm having to look to see if we changed any of this, but this right now would be licensed through the Department of Health. And I don't, Senator Turner Ford, you bring up a good question. I'll find out additional answers for this, but right now, this program is really going to be the only market for this program right now for individuals to probably be licensed. The only market there is through contractors with the Department of Medicaid, those insurance companies that do this, because they're already used to using them in other states, and they found them to be highly successful. So that's probably the only market for this at this moment, but I'll be happy to find out additional information to see in other states, because where I've heard them mostly exclusively used in other states is with their managed care contracts.
Thank you, Senator. Thank you, Mr. Chairman.
Further questions? You ready to vote? Motion's title sufficient to pass. All in favor say aye. All opposed, no. It appears the ayes have it. The ayes have it, and I will just make clear that before we call the bill up on the floor, we'll have an opportunity for Senator Hill and Senator Parker, and we needed to get rid of the preamble, didn't we? Well, we can reconsider the vote by which the bill passed. All in favor say aye. All say no. Appears the ayes have it. The ayes have it. Senator Hobson moves we delete the preamble. Ready to vote. All in favor of that amendment say aye. All opposed, no. The ayes appear to have it. The ayes have it. The motion now is title sufficient to pass committee substitute. All in favor say aye. All opposed, no. The ayes have it. And as I say, if Senator Parker and Senator Hill and others who have this concern, I'm sure the State Department of Health and Senator Boyd will sit down with you, and we'll work out something to alleviate some of those concerns. The next item on the agenda is Senate Bill 2669, anesthesiologist assistance. The position of anesthesiology assistant exists in some neighboring states, but not in Mississippi. An anesthesiologist assistant is somewhat similar to that of a physician assistant, which we do have, but this is particularly in the area of administering anesthesia. I've been informed, and I believe it to be the case, that Mississippi College, if that name is still correct, intends to, or at least is considering having a training program. The existence of this license and this program would allow anesthesiology assistants who are now practicing in other states to come into Mississippi and practice, which they can't do right now under existing law. Having said all that, most of my discussions about this have been with the State Board of, the State Medical Association, and David Roberts is here with them, and you have with you some people who might wish to or be willing to talk to us about the program. So if you're willing to, would you come introduce them and let them explain to us some of the details of this?
Thank you, Mr. Chairman. We're delighted to be with you today. I do have members of our medical association, Dr. Lori Hill Marshall, Dr. Tyler Stout, and the Dean of the School of Mathematics at Mississippi College, Dean Marshall, here to speak and give some clarity and context on the bill.
Well, we'll just go in what order you tell them to go in.
Yep.
If you don't mind, just tell us who you are and talk to us about the concept and
Yeah, so my name's Tyler Stout. I'm anesthesiologist, primarily work at St. Dominic's. Been in Jackson for 10 years, working in Baptist and St. Dominic's. And, you know, ever since I've been here, we've had mid-level providers in this state, but we've only had CRNAs. And then we were doing fine, and then we got to COVID. And then post-COVID, we have a shortage of mid-level anesthesia providers in this state. And we've been trying to figure out how do we bolster those numbers. And in our minds, the way you do it is either we add more CRNA schools or we add a different type of provider. The different type of provider that we're talking about is called an anesthesia assistant. And just as Senator Bryan mentioned, their route is to go through a 4-year undergraduate education in pre-medicine. They then take the MCAT, and then they go into a master's program for anesthesia assistants. This is a 24 to 28-month program where they are doing clinical work as well as learning in the classroom. After that, they work with anesthesiologists in a care team model. Of note, they are trained by anesthesiologists. And we feel that this would be a very good way to bolster our mid-level anesthesia providers in this state. We think it's safe. There are many studies that show that their safety in a care team model is identical to other mid-level providers in a care team model. We, as far as I know, are the only medical specialty in the state that does not have 2 options for mid-level providers. Everybody else in the state can use an NP or a physician's assistant. And we are the only provider that has CRNAs only. And so we do think this would help. We think it would bolster the numbers. We think it would help with the shortages that we have with the mid-levels. And I will turn it over to Dean Baldwin.
just to interrupt, you've mentioned the CRNAs. There's nothing in this legislation that affects the existing rules about CRNAs or would prohibit more education, more CRNA skills and all of that. This is just to supplement CRNAs and
That is
another group of people an opportunity to practice.
that is correct.
Thank you. I'm sorry.
Hi, I'm Stan Baldwin. I'm the Dean of the School of Science and Mathematics at Mississippi College. As you had pointed out, the AA program is a lot of parallel between that and a PA program. About 15 years ago, Mississippi College started the first graduate level PA program in the state. We've been through this process before, and there's a lot of similarity, parallel between a PA, mid-level healthcare worker in terms of generalist, and an AA. So Mississippi College does have a very serious interest in beginning this process of perhaps creating a program that we could also train AAs for the state of Mississippi. Some of my students currently at Mississippi College go on to AA programs because that's what they want. But they cannot then come back to the state and practice that craft. They have to go to a state where it is legal. So that's what we're intending to do per approval or licensure for the state of Mississippi is to proceed forward into that. And the process of beginning that program, again, very similar to what we went through when we started the PA program.
Questions? Senator Blackwell.
Thank you, Mr. Chairman. Are these folks going to be administering anesthesia?
The students will, once they have gone through their training, and exactly what they do in terms of their scope of practice, et cetera, would be something that my colleagues behind me would be better to answer.
Well, and the question may be better for them, but they've gone through school, they've got their credentials. Are they going to be administering anesthesia in the OR?
So after they complete their bachelor's program, they'll go through about 56 to 132 hours of didactic work, and then they will do a 24 to 28-month program directed at anesthesia only. So that's what they'll do, and they'll be taught by MDs, other CAAs, et cetera. And then after that, they will be a mid-level provider, similar to a CRNA. CMS, as well as all the insurance payers, make no difference in payers as well as services related to CRNAs and CAAs. So they are considered mid-level anesthesia providers, but they will be under medical direction.
So the answer would be yes, they're going to be,
Yes.
all right. Are they, who's in the room with them? Is there an anesthesiologist in the OR with them?
So it's in the medical direction model. So there will be a supervising anesthesiologist with them, and usually under medical direction, an anesthesiologist is allowed to supervise 4 rooms, and that can be a combination of CRNAs and AAs.
So basically, no, they won't be, there won't be a physician in the room.
There will
Or
be
anesthesiologist, yeah, obviously the surgeons.
there
gotta
will
there.
be an anesthesiologist in the room for emergence throughout the case, and as well as for induction. But there will not be an anesthesiologist in the case for the entire procedure.
It almost seems like a business model because you just mentioned the CRNAs, they're going to have the same capabilities. The CRNAs go through vast, tremendously more training than what these AAs are going to go through. And I imagine they're cheaper.
So
So is the plan to replace CRNAs throughout the state with these AAs?
no, so the plan is to add this as an additional mid-level provider. Their salaries are similar and the training programs are actually the same. It's just the pathway to get to the training program for anesthesia is different. So whereas CRNAs start with their Bachelor of Science in Nursing, and then they practice for a year, and then they go into the CRNA program, the AAs start with a bachelor's program, but the program for anesthesia for both entities is around 24 to 28 months. And then after that, they are both, I guess, they both have about the same number of hours of training. So AAs during their 24 to 28 months undergo about 2,000 hours of clinical training, and CRNAs undergo about 600 cases, which is equivalent to about 2,000 hours of training as well.
Thank you. Thank you, Mr. Chairman.
Senator Hill.
So what does their bachelor's degree entail?
So they can have a bachelor's in anything, just like you can if you want to be a physician to go to medical school, but they do pre-medical requisites. So there are requisites for the CAA program that are basically the pre-medicine tract. And then they do take the MCAT and or the GRE for entrance into CAA school.
Do we have a shortage right now in CRNAs?
We have a shortage of all mid-level providers, yes.
Thank you.
Senator Parker.
I have a comment for the chairman before I have my question. My comment was that yesterday, when we opened our first public health meeting, the chairman made a comment that we weren't going to be taking up much scope of practice. And my comment is that I find myself ill-prepared for this meeting. As a result of that, I think I should have done some more homework on this issue because I do find myself ill-prepared to make this decision, but because I don't have the information. I know this is the third scope of practice bill I believe we've at least talked about in some shape or form today. And I do know from my malpractice payments that I have to pay that they're not going down. And I know for anesthesiology, I believe they are the highest of any field right now. Is there any information or any data you can give us that would tell us that the implementation of this would take malpractice rates down in Mississippi, would take it up? Or is there any document you can give us that gives a comparison of malpractice rates in states that are doing this practice versus ones that are not?
So we could definitely get you some information on malpractice rates. There are also a lot of studies that are out there that look at risk management, quality of care, and so forth and such, comparing CRNAs and AAs. And in none of those studies have they found any difference as it relates to quality of care or risk management.
And again, in being here for 13 years, what we typically do in a situation like this is we tend to hear both sides of a scope discussion, where we might have a CRNA, we might have, you know, anesthesia assistant come, and that we, you know, we get information and we see that, and then we make a challenging decision on that. And, you know, with the chairman's help, I know we've done that many, many times. And I just think with anesthesia, you are some of the most important people in our state. And I've shared this with the committee. My wife has been put to sleep too many times. And I just want to be sure that when that happens, the person in that room is qualified, prepared, and backed up to make that happen.
Well, regarding the scope of practice situation, the legislation that we've been considering today is to establish anesthesiologists in Mississippi as they exist in other states, to establish community health workers as they do in other states. And I guess I didn't look at it as a scope of practice to simply establish a license for other professions that already existed elsewhere. I can see how you could take it that way. As far as the other side, I didn't know of any opposition to having physician assistants. If there's opposition to the program, are you aware of opposition to anesthesiologist assistants?
I just have email here from CRNA PAC Central. And again, you know, I get a lot of emails. I'm not telling you this is factual. I don't know. It is a strong opposition letter.
Well,
And
I
I
have,
just,
if CRNA PAC Central wants to speak in opposition to the bill, why don't we just lay the bill on the table subject to call, and we'll meet again Tuesday, and we'll have an opportunity for CRNA PAC Central to come speak against the anesthesia assistants.
and I would also welcome someone in the field that you're proposing to come speak as well. You know, but I do think this is an extremely important matter, and I value what you do tremendously. You know, you are some of the most important people in healthcare, you know, and I just want to be sure that that value continues to be as high as I feel it is. You know, so I would make that motion at the appropriate time.
Okay, well, let's go ahead and hear from the people that are here and ask questions of any of them, and then we can entertain a motion to table subject to call and consider the rest of the bill on Tuesday. And that'll give you opportunity to invite anyone you'd like to speak, and we'll have time for them. Senator Hickman.
Whoever can probably answer. I just have a couple of questions. This is a practice that's already happening in other states. How many other states provide practice of this sort?
So currently they are licensed in 20 jurisdictions, including Washington, D.C., and within the Veterans Administration system. Our closest neighbors are Alabama, Georgia, North Carolina, Florida, and South Carolina.
So, do you know, or do you have any data whether there has been I guess for lack of better words, a collapse of healthcare, or there have been major issues, or malpractice insurance has gone up, or any of these things happened since they've started providing or allowing this kind of practitioner to provide these particular types of care?
No, there have not been any changes in malpractice insurance, upwards or downwards. But of note, CAAs are only allowed to practice in the medical direction model. CRNAs can practice in medical direction or medical supervision, which means that one anesthesiologist can cover more than 4 providers at the same time with CRNAs, but with medical direction with CAAs, they're limited to 4.
And I don't know if you guys will be coming back. So I think you've said this, and I'm gonna make this very quick, but it's from hearing what you're saying, almost the same amount of training and education as CRNAs. This just allows people to go through a different track to get here and comparable pay or compensation. So it's not like they're going to be hundreds of thousands of dollars less and CRNAs all over the state are going to be out of jobs. Do I have that correct?
That's correct. We have a shortage of mid-levels throughout the state, and I think Dr. Baldwin can speak to this. They're looking at potentially graduating maybe 30 students or so a year. We currently have a CRNA program at Southern Mississippi, and I know that they're looking at possibly doing one in the Metro Jackson area as well. But there's a shortage of mid-levels across the state, and 30 providers would definitely help. And we know that all 30 of those wouldn't necessarily stay in state. But for those who have been in Mississippi and now they've trained to be a CAA and are living out of the state that would like to move back, this would give them the opportunity to come back home.
And finally, what kind of issues has this shortage caused, like there being a shortage of mid-level providers?
Yeah, sure. Just maybe 3 weeks ago, we were shutting down ORs at the University of Mississippi because there were not enough mid-level providers to run the rooms. I mean, that's just here in Jackson. One of the major issues in the state is not only is the shortage happening because we don't have enough people, but we're also stretched because every surgery center, every surgeon is now moving stuff outside of the hospitals, and we all want 7 a.m. starts, okay? And so whenever you stretch the system horizontally, we end up with more starts than we have providers, and that's what happens. So we not only have a shortage of bodies, we also have a shortage because we keep needing more and more and more. And yeah, I mean, just a couple of weeks ago, this was happening at the biggest hospital in the state.
Senator Parker.
I just find it ironic that we're using words in here like someone almost has as much training as someone else, and we have a shortage, so we should allow them to do something. I have sat in here nauseating hours discussing and talking about, one thing or another, and I've never heard the word almost. So I guess if we have somebody go all the way through medical school and almost graduate or almost pass their boards afterwards, they're almost a doctor. And so they are almost there. So we should just let them into the healthcare system. We have to be very, very careful in this body to make sure that people who are qualified are providing the care. And that's our role. I just want us to remember that, because I just don't understand the word almost in this discussion. And and maybe someone can help me if I'm out when we leave here to understand that more. But I will share my comments with members outside.
Anyone else? Do any of you have anything else you need to tell us or you want to respond to before we finish? Any more questions? Well, if not, thank you for coming to, go ahead, I'm sorry.
Yeah, I was just going to say, look, we respect your request to have others speak. I mean, I think that's very reasonable. And I think another thing to understand is we're very supportive of all mid-levels. This is not anything to suppress another group. This is more to bolster our numbers. But I think it's a good idea. Let's talk and we'll try to get somebody from the AA body to come here and talk and let them kind of represent themselves as well. And I think I think that would help.
If I could, Mr. Chairman, again, I just want you to understand that this is probably the first time you've been in this room. It's not the first time most of us have been in here. So the discussion and things like this has been heated and has been interesting on a lot of different levels, you know, and so I appreciate you indulging us as we do what we do in here. But yes, an AA would be a welcome resource. A CRNA would be a welcome resource. You know, someone from your association also could be here. You know, this may be exactly what we need to do. I'm just not sure. So thank you.
Yep, thank you.
Thank you, Mr. Chairman.
And is there a motion to table subject to call? Are you ready to vote? All in favor of the motion table subject to call, say aye. All opposed, no. The ayes appear to have it. The ayes have it, and that motion is agreed to. We'll now, thank you very much for coming. We'll now take up item 2075, not 2705. The Board of Medical Licensure legislation. We have an amendment to the bill is introduced. Do we have copies of the amendment? The amendment, I think, is very brief. Would you just read the proposed amendment?
On line 810, that begins subsection D, and the proposed amendment is to eliminate the language that appears after the word surgeon or any other word or abbreviation to indicate or induce others to believe that one is engaged in the diagnosis of or treatment of persons afflicted with disease, injury, defect of the body or mind, or other conditions for which treatment is sought. And that's prohibited conduct. So it just cleans up that item. It would also include the inclusion of the word or before surgeon there at D on line 810.
So looking at line 810, just to make sure I've got this correct, we would put the word or after physician there on line 810. Include the word surgeon, and then thereafter strike the next phrase, leaving the word or, just for grammatical purposes. So for all practical purposes, we strike everything after the word surgeon on line 811 in that subparagraph D, and then move the R's around to make the grammar correct. We're ready to vote on that amendment, which I understand has the support of the Board of Medical Licensure, and I don't know of any opposition to the amendment. So if we're ready to vote on that, all in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. I believe this is a bill that we have discussed in the past, and I think it has never quite made it all the way through the legislative process. It's my understanding that the Board of Medical Licensure has taken the legislation that was considered last year and, including this amendment, made some other changes, hoping to reassure those who had misgivings about the bill. As the bill stands before us today, now that we've adopted that amendment, I do not know of any opposition to the bill. So this is the bill which basically lets the Board of Medical Licensure deal with situations that exist today that haven't really been a problem umpteen years ago when their legislation was last introduced. Is there questions or debate? Senator Parker.
For just a brief moment of personal privilege. I just want to thank Dr. Edney. I want to thank the team that you work with to put this together. I know this was a lively debate last year. I appreciate you bringing language to me ahead of time and making edits. And I do think that in discussion with you, Dr. Edney, and with Dr. Cleveland, we all recognize that we have a large number of new doctors in the state, and that this being in place will give the board and will give Dr. Cleveland some better ability to make sure that everything is being done correctly. And so I thank you for that. And at the appropriate time, Mr. Chairman, my motion would be title sufficient do pass.
This is the appropriate time.
So moved.
Senator Hobson.
Thank you, Mr. Chairman. I've got two questions. One is on line 453. I'm curious as to what the purpose is about saying no deposition shall be taken in preparation for matters to be heard by the board. You don't know.
I don't have an answer for that. I would surmise that the board has felt that that was being abused, but we certainly can get an answer
Okay.
for you if someone's not here to answer
Thank you.
that today.
The second question, or really a comment, is I've read this about 3 times and I still am confused about the language, but it starts on line 73. It's related to subsections 1, 2, and 3 under that section C. And actually going back to line 65, the chapter shall not apply to the following, and then that subsection C talks about commissioned medical officers. But then 1 says such persons who hold medical license in the state shall be subject to the provisions of this chapter. Section 2 says such persons shall be fully licensed to practice medicine in 1 or more jurisdictions of the U.S. I'm just confused on the word reading. It appears to be saying it doesn't apply at the beginning of subsection 3, and then subsection 1 to subsection C seems to say that you are subject to the provisions of this chapter. And maybe I'm tired and it's late in the day, but I can't make that reconcile.
Did you say you had read the bill?
The bill in its entirety? No, sir.
But you've read portions of it.
I've read portions, yes.
You
Sir.
said some of it 3 times
I read that portion 3 times.
before the committee meeting.
Pardon?
Before the committee meeting.
No, as I'm sitting here, let's
that's-
debate all the other issues.
That's bordering on cheating. It's like reading the statute before you go to court. I think the best thing to do is to just see if we can get someone to sit down and work through the various inclusions and exceptions and see
I
if we
agree.
can figure out the grammar.
Thank you, Mr. Chairman.
Senator Hill.
First, I'm going to say something, and I mean it truly. I'm not just saying this. I think you do a very good job as chairman. I would make a suggestion. I know this will be hard, and I've wanted this since the day I got here. If there's any way that a committee could get 24 hours notice, or at least 12 hours notice of the bills that we would be taking up, so that we could at least look at them before we come in here, because we can't read 2,000 bills. So if anybody can facilitate that, I think you're the genius that could do it.
Well, thank you for the kind comments. And you never need to qualify or apologize for saying pleasant things about the chair. You can just jump right into that anytime you want to. It'll be fine.
I thought you were a great Judd B chair. I truly did. That was one of my
but
first committees
seriously,
I ever served on.
Seriously,
I thought you were very fair. Thought you were very good.
Well, seriously, I appreciate your comments, and I think members of the committee know I think this is a very fine committee. And just personally, I'm glad every single person who's on the committee is on it.
Now, you don't take up
the-
every bill that I want you to take up, but I think you handle the
No, no,
committee
no,
very
that-
well.
That's all right. But first of all, you're right. We do need more time to look at bills. It's not always possible to do that, but we could do more of it. You may have noticed the delay in bills being referred to the committee, which has made it difficult for me and other committee chairs to do exactly what you suggest, which is have advanced knowledge of what's coming up in the committee. So, I mean, I think I got all this together this morning shortly after adjournment, which is, at least several hours. But you're right, it's better to have more time.
Thank you.
And now having had that conversation, we have Senate Bill 2704 that's not on the agenda that we will consider. Do we have copies of 2704? This is well, Senator Parker, I think you and I have a different definition of scope bill, so it may very well be in your world. This is a bill that Senator Barnett is introduced and asked that we consider, and it's doubly referred to corrections is why we need to do it today. The bill simply provides that the Department of Health will annually inspect the infirmary at Parchment. And the State Board of Health tells me they're agreeable to doing this. Senator Barnett is the Chair of Corrections, and he's introduced the bill. So that's the bill, and that's why we're considering it at this time. Senator Barnett, do you want to make a motion and then explain to us the merits of the bill?
Thank you, Mr. Chairman. Like Senator Hills, I think you've already done a good explanation of the bill. And glad to see Dr. Etney here today as well, because he touched on part of this bill on yesterday by identifying the importance of making sure that our prison population is as well as the general population, because at some point then they are going to be released. And this is just another mechanism to make sure that our infirmary or hospital there at Parchment is where it needs to be in regards to the health care of our prison population. So that's an explanation of the bill, Mr. Chairman, and I move that title sufficient do pass.
Are there questions or debate? Are you ready to vote? All in favor say aye. All opposed, no. The ayes have it. We'll report that bill to the Corrections Committee. Thank you all for coming. Senator Fillingham. Senator Parker says we voted on it. Or we voted on the amendment. Okay. Well, then the motion recurs on title sufficient do pass Senate Bill 2075 as amended. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Thank you. I'm pedaling as fast as I can. So we'll meet again at 3 o'clock on Tuesday, which is our next scheduled meeting. And we'll go as long as we need to. Thank you all for coming and staying with us, and we'll see you Tuesday. Is there a motion to rise and report? All in favor say aye. Opposed, no. The ayes have it.